Hi, welcome to another Right Way Wednesday. My name is Melinda Ricchetti from the Quality Assurance and Compliance team. Before I jump into today's topic, I just wanted to give a quick shout out to Amy and Jessica, who did last week's Right Way Wednesday, on the challenges that rehab directors and clinicians often see. If you haven't taken the time to watch it yet, please do check it out on our Documentation Success Facebook page. They did an awesome job, and Jessica, we really appreciate you jumping in, getting out of your comfort zone and doing a video blog. It was great. Thank you. We hope that many of you out there can join us in doing some of these Right Way Wednesdays. You all have so much to add. We'd love to hear from you. So today I want to briefly discuss three components of safe transitions and the documentation behind them. And that's really what my focus is the documentation of them. We'll look at discharge planning, patient and caregiver education, and health literacy, all very large parts of our Safe Transitions program. What we want to see in our documentation is all three of these components documented well and throughout our chart. So first and foremost, discharge planning. I know you've probably been hearing a lot about this lately and how important it is. We really want to see that patient transition safely and effectively to the next level of care. And so that discharge planning needs to start from day one, right from the evaluation. It can start with a very specific plan documented on your eval. I notice a lot when I'm doing my audits, very broad, general discharge plan, like return home, stay at this long-term care facility, when goals met, that type of thing. We really want to see that be specific. What are your anticipated levels of functioning for that patient? What do you expect the levels of care that they're going to need when they discharge? And that type of stuff should be documented on eval. You may not know it, but you're projecting it, and it's formulating your long-term goals. So you should have something in your mind. Now, will their specific discharge plan change? Quite possibly. And when it does, we'll just document those changes, adjust our goals if needed, and move on. But on eval, we should have something in our head, a very specific plan of what we expect for that patient. Additional parts of discharge planning that we expect to see in your documentation throughout your patient's chart are home safety evaluations early on in the plan of care, so that you can work on the items and the functional activities that the patient needs to in order to go to that discharge location safely. We also expect to see that warm handoff to the professional at the next level of care. Is there communication with the home health agency that you'll be discharging him to? Other parts of discharge planning are just really documenting the goals that you're setting and how it will pertain to them being able to transition to that next level of care. Medication management may also be a part of this discharge plan, especially if your patient's going to be expected to do all of their med management. You'll need to see that in your documentation that it's being done. This goes into health literacy, really, because you think about the fact everything that we're doing to prepare those patients to be safe in their discharge. Health literacy, patient and caregiver education should be a part of that. With health literacy, we want to make sure that they're able to manage their current medical conditions and be proactive with that management in order to help mitigate the risk of them being rehospitalized. So really making sure that when we are teaching that symptomology and that education behind whatever current medical conditions they have, especially chronic ones, that we're documenting that education. If we're providing handouts on it, that we're documenting that that was done. We can also really work with nursing on this as far as education goes on that health literacy component. So just remember, when you are educating your patients and their caregivers on health literacy aspects, that you're showing them that it happened in your documentation. Often we don't give ourselves credit for what we're doing. So you documenting what type of education you're providing, document their competency with it. Are they able to teach it back to you? And documenting that teach back factor is important. I think it's also important providing the handouts, because often when they're discharging from a skilled nursing facility or when they have a lot going on, they may not be listening to you entirely. And having those documents are important for them to refer back to, especially with those chronic conditions. And if they have exacerbations with those chronic conditions, there's a reference that they have that they can refer back to. So the last part of safe transitions documentation that I wanted to discuss today was patient and caregiver training, which we have talked about a little bit already, but I just want to specifically dive into that a little bit more and making sure that you're documenting all the components of patient and caregiver education when it's happening in your plan of care. So that includes who is being trained. I know that one seems kind of obvious, but it's actually very important because often we see transfer training under the patient caregiver education section, and I don't know if that transfer training was for the patient themselves or for the caregiver. Or for the CNAs or the daughter or whoever. So it's important to document who specifically was trained, what they were trained on, the specifics of that in the detail, what the outcome of the training was, were they competent, did they demonstrate, were they able to teach it back to you, and then the recommendations for future. If they are completely competent, then no longer need to be trained, but if they're not, what's our plan to continue this training? So just to recap, very quickly, Safe Transitions is a large program that we have within Health Pro Heritage. I did not go over all of the components of it today by any means. I specifically focused on discharge planning, health literacy, and patient and caregiver education, and how those should be threaded throughout your documentation, showing that they are occurring ongoing during the whole entire plan of care. That's all I have time for today. There's lots and lots of resources, not only on documentation, but also on Safe Transitions. All of it is housed on the company documents icon on your Health Pro Heritage laptops. So please, rehab directors, check those out. You have access to them. You can pass it down to your clinicians. If you're a clinician and don't have access, reach out to your rehab director or your RVP so they can give you that type of access. Additionally, guys, CEU 360 has all of this stuff, and we all have access to that. So please log into CEU 360, search Safe Transitions. You'll be able to find everything, or reach out to me or the documentation and denials team with any questions, or ask a question here on Facebook. Thanks for joining us. We hope you tune in next week for another episode of our Right Way Wednesday. Thanks, bye.